Hey, Dr. Jerry Williams with Urgent Care 24/7 here to talk to you about jellyfish stings. Now, this is obviously only going to apply to people along the coast, but for those of you inland folks watching this that visit the coast, let's hope you don't have an encounter with the jellyfish, but if you do, this video will be very helpful to you, I think. So where we are in Savannah, Georgia, in the summertime, we have a lot of jellyfish that are along our coastal waters. And so jellyfish stings are incredibly common. They can be really, really painful. And there's actually another kind of sting that presents from time to time where people think they've been stung by a jellyfish, but they've actually been stung by a man of war. And these stings are much more severe than the common jellyfish sting. But let me tell you, the jellyfish itself can be pretty painful as well. What happens is that the tentacles that drape down and float along with the jellyfish or the man of war have what are called pneumatocysts, which are small little stinging devices that hold venom in the device, and when they are touched, they immediately inject with a barb-like structure into the skin, and then there's a fluid-filled sac that's full of venom, and it actually injects into its target, into its prey. And this has to do with how they capture fish or organisms to eat, but also it's how they defend themselves from predators. So when it comes to jellyfish stings, if you get a jellyfish sting, the first thing you need to do is immediately wash the area with saline or salt water. Now, you don't want to use either regular water, and some people will say to use bleach or vinegar, and there's even an old wives' tale about using urine on it. And actually, urine would probably be, out of all the things that I just mentioned, the better choice, because you want to use something that's got a similar specific gravity or molarity to blood. So you want it to be as not hypertonic and not hypotonic, meaning you don't want something that's too dilute or too concentrated to clean the area. So I would suggest using ocean water is fine to flush the area. And then the use of topical lidocaine, which you can get over the counter, is actually very important. But it's best if you can spray it on or slather it on very gently, because any kind of physical disturbance of the pneumatocyst that's actually in the skin of the patient is going to cause those pneumatocysts to inject more venom into the patient that's been stung, into the victim. So if you can spray on lidocaine spray, which is used for sunburns, etc., or use lidocaine containing gel, that can be helpful, and leave it on for about 15 or 20 minutes. Then take something like a credit card and scrape the gel off. And what you're doing by scraping that, or you could use maybe a plastic spoon or something, but as you scrape that off, you're actually scraping and pulling the nematocysts, which you can't see, out of the patient's skin. We call that debriding. You're removing the nematocysts. So using the nematocysts to getting the nematocysts removed using the credit card or the spoon or a piece of plastic or metal that's not too sharp where it's going to cut, but will scrape the nematocyst and actually pull them up out of the skin, is important. Now, what's thought is that the lidocaine actually disables the nematocyst before you start removing it somehow or another, and it's poorly understood, but the lidocaine seems to disarm or render the nematocyst unable to inject the poison in further. Also, importantly, those topical lidocaine gives relief to the patient who's been stung as well. So there's twofold reasons why we encourage lidocaine topical use before you start removing the nematocyst. and then using a topical aloe kind of gel or antibiotic to prevent infection is also an option. Now, if somebody gets a severe sting or if they have a significant reaction, they may have to be treated for an allergic reaction, just like with a bee sting. People can have allergic reactions to jellyfish and man-o-war stings. So if that happens, they need to seek medical care immediately. And we typically advise if anybody's got a significant jellyfish sting, that it's a good idea to get seen by a healthcare provider if you've got any questions about your reaction to it or if you've been able to properly debride the area. What happens if you don't get the pneumatocyst out of the skin? There can actually be a secondary reaction days to a week later where the body's trying to push out the barb that's still underneath the skin, and there'll be a significant allergic reaction where the body's trying to repel that, as if you had a splinter in your skin. These little bony, sharp, hypodermic needles, if you may, that are in the pneumatocyst, the body's going to try to rid those, and you're going to have an allergic type reaction longer term as your body's trying to get rid of those. So if you have any questions about whether you've been able to debride effectively or if there's any kind of an acute reaction, be sure to seek medical care. And don't forget topical lidocaine, soothing gels like aloe, and antibiotic ointments. And infections secondarily can happen with jellyfish stings. So if there's any signs or symptoms of infection in the days after a jellyfish sting, be important to see your medical provider for that as well. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.